Hello, my name is Jasmine Deakin and this is my presentation on human immunity. Before I begin to discuss the defences against disease, I first need to briefly touch on what an infection is, what causes disease and their methods of transmission. So infection is characterised as an invasion of the body by microorganisms that are not normally present in the human body, such as bacteria, viruses, fungi and parasites. Since not all infections produce symptoms, they can be difficult to detect. Now, there are different methods of transmission with infections. Direct contact with a person or animal who is a carrier for the infection is probably the easiest way to catch most infectious diseases, for example, through touching, kissing, coughing, or sneezing. Indirect contact occurs when an infected person contacts or sneezes on an object that is then touched by a non-infected person. For example, if someone was to sneeze on their hands and touch a TV remote, the next person to touch that remote can become infected. Insect bites are also a common method of transmission. In some parts of the world, malaria is passed through mosquito bites. And another common way that someone may become infected is through contaminated food or water, typical for the transfer of bacteria like E. coli, which is present in certain foods such as uncooked meat and unwashed salads. So first of all, let's take a look at the first and second line of defence. So these are non-specific defences and demonstrate the same response to all pathogens in exactly the same way. Physical and chemical barriers are used as the first line of defence to keep pathogens out, and the skin plays as a barrier to infection and actually forms part of the integumentary system, which consists of three major layers. The outermost layer is the epidermis. Underneath this layer lies the dermis, which then moves to the deepest part, which is the subcutaneous layer. So, being the largest organ of the body, the skin provides a mechanical barrier against pathogens, and the skin forms a waterproof protective coating, which is crucial to the body's first line of defence against infections. And the epidermis acts as a barrier from external environmental toxins from harming the body, and as long as that skin remains unbroken, that is. So another example is the nasal cavity and airways. So many pathogens can enter the body through the nasal passage. However, these can be filtered out before they pass the barrier between the body and the external environment. These pathogens become stuck to the mucus lining in the interior of the nose, which can then be removed by blowing the nose or through coughing. And this removal is aided by the actions of the cilia in the lining of the airways, removing these microorganisms away from the lungs and fighting potential infection. Now, moving on to the second line of defence, these can include inflammation, fever, phagocytes, and complement proteins. In relation to an inflammatory reaction, this is often triggered by a skin injury or infection, and the inflammatory response is a series of cellular events that occurs in response to a damage or infection to the immune system. Now, the inflammatory response's primary physical effects is to increase blood circulation across the infected region, as well as the cells surrounding that area, creating holes in their cell walls, allowing immune response blood cells to move through, resulting in increased strength of the immune system. So there will be an increase in body heat in the infected region, which can have an antibiotic effect. And if an anti-inflammatory response has started, it is likely to continue until the infection that caused it is actually healed. So we'll look a little deeper into specific aspects of immunity in a moment, but in order to understand this section, let's look at what antigens and pathogens actually are. So a pathogen is an infectious agent, so it's a microbe that can cause an immune response and make you sick. These can be bacteria or viruses, but they can also be protozoans and fungi. So a pathogen is something that can cause an infection but is too small to be seen through the naked eye. An antigen is parts of the pathogen that tell your body that it's being attacked. So antigens can be any type of molecule such as carbohydrates, protein, nucleic acid, or fat. And in order to infect the body in the first place, the pathogen often requires the antigen. Antigens on a virus, such as influenza, actually help the virus reach the cell, are examples of antigens. Now, moving on to the third line of defence, acquired immunity is a learned response from the body's immune system that determines the best way to attack each antigen and begins to form a memory for it. So it can also be called specific immunity, and this is because it's tailored to attack specific antigen that the body has encountered. Natural immunity entails exposure to the pathogen without any human intervention, and once exposed, the body's immune system begins to fight off the disease-causing agent. Once protecting against the agent, the body develops memory of the agent, which constitutes naturally acquired immunity. So an example of this is when the body becomes infected with chickenpox. And this is why when people catch chickenpox, they are unlikely to catch it again. So natural immunity is essential in providing against the varied range of infectious agents in the body. So moving on to immune system cells, leukocytes, also known as white blood cells, are immune system cells that help the body fight pathogens and foreign objects. So there are 5 different types of leukocytes, all of which are produced in bone marrow. This includes neutrophils, monocytes, lymphocytes, eosinophils, and basophils. So humans' acquired immune systems are actually in charge of destroying pathogens after they've been invaded by the body. The acquired immune system discovers how to target and kill the pathogen during the first exposure to it and protects the body from harm. So cells of the acquired immune system are mainly the B cells and T cells. Okay, so immunoglobulins, also known as antibodies, are proteins that are bound to antigens. So antibodies have many uses within the body, such as targeting an infection, recruitment of immune cells, neutralization of toxins, removals of antigens, complement activation, and stimulation of cells and that can eat foreign substances. So there are 4 chains in a standard immunoglobulin, and since 2 of the 4 chains have a slightly higher mass than the other 2, as we can see here, an immunoglobulin molecule can be defined as having 2 heavier chains and 2 lighter chains. So moving on to the 5 cases of immunoglobulins. These include IgG, one of the major activators of complement pathways, and this is also the only form of immunoglobulin that crosses the placenta from the mother to the fetus, offering some defence to the unborn child against diseases that they haven't yet encountered. IgA, that plays an important role in cellular defence of the soft mucosal surfaces of the body, such as inside the mouth and the throat. IgM, that's present on the surfaces of immature B cells and takes part in the immune response and plays an important role in controlling bacteria that can find its way into the bloodstream. IgD is a trace antibody in the serum that is present on the surface of B cells, and it may be involved in suppressing these antibodies, producing cells in the manufacture of antibodies. And IgE. This is only found in very low levels of a healthy individual, but it will increase significantly as a response to allergic reactions. So hay fever is also caused by too much IgE activity. So following on to self-recognition and tolerance in the immune system. This is the ability to actually recognise what it is and not react or attack against it. So the immune system achieves this goal through the mechanism of antigens. And because of the existence of the antigens, the immune system is able to distinguish between self and non-self, allowing only the non-self to be targeted. The two most important factors helping the immune system to distinguish between self and non-self are the major histocompatibility complexes I and II, as well as the human leukocyte antigen gene complex. So human cells typically express unique antigens that the immune system recognises as self and responds to appropriately. As the immune system comes across the antigen on red blood cell surface, it recognises it as self and doesn't attack it. This moves on to the failure of self-tolerance. So hypersensitivity is an immune disorder. It is an overreaction of the immune system to an antigen which would not normally trigger an immune response. So some examples of hypersensitivity reaction would actually be conjunctivitis and allergies such as peanut allergies or hay fever. So a second example of this is autoimmunity. In this case, the immune system attacks cells, organs and other structures from its own body, mistaking them for foreign elements, and this can result in the organs becoming inflamed and damaged. So we'll move on to the rejection of transplanted organs. So the act of moving cells, tissues or organs from one location to another, usually from one individual to another, is known as transplantation. And this procedure involves replacing a defective organ with a healthy organ from a donor to correct an organ system's malfunction. So some organs that may involve transplants include the heart, lungs, kidney, liver and bones. So the immune system, on the other hand, is a formidable barrier to transplantation as a routine medical procedure. We've seen how the immune system has evolved and developed efficient mechanisms against foreign invaders, and these pathways are also involved in transplanted organ rejection. So when a person receives an organ from another person during a transplant surgery, the immune system of the recipient may recognise it as foreign. This happens when the immune system senses that the antigens on the organ cells are different, causing the organ to be recognised as non-self. So there are three different types of rejection. There is hyperacute rejection, and this can occur a few minutes after the transplant when the antigens are completely unmatched. The tissue must be removed straight away so that the recipient doesn't die. And then acute rejection, this may occur anytime within the first week after the transplant to 3 months afterwards, and all recipients do have some amount of acute rejection. And then chronic rejection, that can take place over many years, and the body's persistent immune reaction to the new organ causes the transplanted tissues or the organ to deteriorate over time. So moving on to rheumatoid arthritis, first of all, which is a long-term autoimmune disorder that primarily affects the joints. So the body's immune system accidentally attacks the cells that line the joints, causing them to swell, stiffen and hurt. This can damage the joints, cartilage and nearby bone over time. Rheumatoid arthritis typically affects the hands, feet and wrists, and flare-ups are when symptoms get worse for a short period of time. A flare-up can be difficult to predict, but with treatment the number of flares can be reduced and long-time joint damage can be reduced or avoided. Possible factors for developing this is genetic background, smoking, and it can be detected by a simple blood test. So there isn't any cure for this, but treatment and a combination of patient education, rest and exercise, and occasionally surgery can actually help. The next autoimmune system we're going to look at is lupus. So this is another long-term disease in which the body's immune system become hyperactive and attacks normal healthy tissues. So some symptoms of lupus does include joint and muscle pain, extreme tiredness that doesn't go away, rashes that can also bring on headaches, mouth sores, high temperature and even hair loss. So the GP will usually do a blood test, and high levels of a certain antibody combined with symptoms usually is a sign of lupus. Then the patient may be referred for x-rays and scans of the heart, kidney and other organs. So once lupus is diagnosed, there will be regular tests and checks for any kidney problems which lupus can cause. And lupus is generally treated using anti-inflammatory medicines like ibuprofen, steroid tablets, injections and creams for kidney inflammations and rashes. So now we will take a look at what happens to our body when we are vaccinated. So vaccination is the process of exposing the body's immune system to a weakened or harmless form of pathogen in order to induce white blood cells to develop antibodies, which will provide immunity to that pathogen. So there are a number of different vaccines, live and inactivated. Live vaccines are derived from the virus or bacteria, but weakened in laboratories. When a live vaccine is used, a small amount of the virus or bacteria is given, which replicates in the body and produces enough viruses or bacteria to trigger an immune response. Now, since inactivated vaccines aren't live, they can't replicate, and as a result, these vaccines are incapable of causing disease by infection. Multiple doses of inactivated vaccines are common. The first dose in general does not yield protective immunity, but rather primes the immune system for a subsequent dose. And after the second or third dose of immune response, that is defensive emerges. Immunological memory refers to the immune response, the immune system's ability, to identify an antigen that the body has already encountered and mount an immune response in response to it. So the primary response is when a pathogen is encountered for the first time, and it takes some time for the antigen to identify the B lymphocytes, an appropriate antibody to produce by the plasma cell. The second response is the same pathogen encountered for the second time, and the memory cells recognise this pathogen and produce higher quantities of the antibody, which often fight off the infection before symptoms are seen. So moving on to the benefits of vaccinations and how they help us fight off serious diseases. So viral infections cannot be cured by antibiotics and can only be controlled by immunisation. And when a higher percentage of a population is vaccinated, it is more difficult for a contagious disease to spread. Because there are very few people within a population who can become infected. So childhood deaths were more common before vaccination from diseases. Childhood deaths were more common before vaccinations from diseases such as measles. And although it does still exist today, vaccinations provide greater protections against serious complications. So measles was first vaccinated in the UK in the late 1960s with the introduction of the MMR vaccine in the 1980s. So if we compare the data regarding the measles death rate from the 1940s, where 857 people died that year and 1,145 the following, whereas in 2017 there was only one death. So this proves on a global scale the benefits of immunisation and vaccine programmes are wide, from extending life expectancy, reducing death rate and savings in healthcare systems not having to treat those diseases. So in order to comprehend herd immunity, it is important to note that a contagious disease is one that spreads directly from person to person. So there are a variety of possible modes of transmission, but direct transmission is the most important. So it's more difficult for a contagious disease to spread if a large proportion of the population is vaccinated. For example, if a person with measles is surrounded by others who have been vaccinated against measles, the disease can't easily spread, and as a consequence it would rapidly disappear without causing widespread infection. So this is called herd immunity, and it is a form of immunity that occurs when the vaccination of a significant portion of the population provides a measure of protection for the vulnerable. So it is also crucial for those who cannot be vaccinated, such as babies that are too young. There are some problems that may be faced in providing herd immunity, such as failure to produce an immune response if someone already has a compromised immune system, if people don't get vaccinated due to religious or ethical reasons, or there might be a different variety of pathogen, all presenting different antigens. So herd immunity is extremely important today with our global connections. In the past, when human population was considerably smaller, communities were generally isolated away from each other, so it wasn't as easy to spread. However, today our interconnections and mass transportation means diseases are not limited by geography, insisting we must make greater effort to protect ourselves from the spread of diseases, and the herd immunity through vaccination programs is a critical element in this process. That's the end of my presentation. I hope you enjoyed it, and thank you for listening.